In today's political climate, immigrants are a vulnerable population in our community.
They're bringing drugs, they're bringing crime, they're rapists, and some, I assume, are good people.
According to the New York Times, he complained that the 15,000 Haitian immigrants who received visas in 2017 all have AIDS.
We're building a wall. He's a Mexican. We're building a wall between here and Mexico. The answer is he is giving us very unfair rulings.
Immigrant access to health care and other social services is one of the issues embedded in xenophobic rhetoric. There is a belief that services for foreign-born residents will be costly to taxpayers, under the impression that immigrants are unhealthy and will be a financial burden. However, immigrants only make up 1.4% of healthcare spending, although they are 5% of the total population of the U.S. To improve immigrant access to healthcare, we must break down societal misconceptions and other factors affecting the issue. Disparities in healthcare access for underserved populations in the U.S. can arise from a multitude of issues, including high cost, inadequate insurance coverage, lack of available services, or lack of cultural competent care. The barriers to healthcare access result in unmet health needs, delays in receiving appropriate care, and preventable hospitalizations. Matched with language barriers and a fear of xenophobia, the disparities in healthcare enlarge for immigrant populations. According to the Boston Public Health Commission, foreign-born residents are a key vulnerable population in experiencing consistent barriers to health care.
In the current political environment, there is kind of an attitude of retracting on the idea of expanding Medicaid, but there are institutions that are delivering care for people one way or another, with insurance or without insurance. And the reality is that because we provide care to anyone who stands in need of a health emergency, we all pay for health care sooner or later. One of the paradoxes that we're seeing playing out right now is that for individual coverage, there is great resistance. But when you look at healthcare systems that are providing care to real people, not necessarily covering them, but providing those services, there is an opportunity to reach people that you couldn't reach before.
Fortunately, we see many hospitals and organizations that have mobilized to help immigrants, even if it cannot always be done in the most efficient manner, as Dr. Kelly explains. In Boston, there are organizations in place to aid immigrants, some specifically with healthcare. Boston Medical Center, for example, has created the Boston Center for Refugee Health and Human Rights. They seek to provide refugees and asylum seekers the needed mental and physical health treatments in order to establish a healthy, happy life in America. The Refugee and Immigrant Assistance Center is another organization aiding immigrants with a variety of social services in order to help them adjust.
They are enrolled in Social Security, so everybody gets a Social Security card. They get, for the first few months, they are eligible for food stamps. They get enrolled in with the healthcare center. They connected to a primary care doctor. We enroll the children in school, and then the adults are referred for English classes as needed and employment services.
The Massachusetts Immigrant and Refugee Advocacy Coalition is also an important organization for immigrants, helping the population with legal rights, health and human services, and advocacy. These organizations are vital in combating the barriers that keep immigrants from accessing quality health care. Even when immigrants can access health care, there are still barriers that lower the quality of the care with respect to that given to a native-born resident. For example, language barriers can hinder an immigrant's experience in the healthcare system. The South Boston Community Health Center has a variety of translational services, including in-person, on the phone, and machine-based interpreters. While translators are a great resource, it adds extra wait time to that of a typical visit, which is not always worth the patient's time. The aspect of fear is another barrier that may not always keep immigrants from accessing care, but make them apprehensive. While most of the immigrant patients at the South Boston Community Health Center feel comfortable surrounding status, some request to speak with someone before applying to be patients. This meeting is usually a product of fear surrounding the part of the application that asks about citizenship, with concern their application will result in legal action. This does not happen, however, it is a reasonable fear for immigrants. It is plausible that this apprehension keeps many immigrants out of the healthcare system entirely. From a local perspective, the issue lies less in immigrant use of healthcare, but more in the quality of the care. Organizations in Massachusetts are providing services that help immigrants combat obstacles and access the services they need. From a systematic view, the xenophobia that is rooted in America's political climate has created a belief that immigrants will overrun the healthcare system. In reality, it induces a fear in the foreign-born community that keeps them from utilizing services. Before immigrants will reap the same benefits from the healthcare system as natural-born citizens, misconceptions must be chipped away through advocacy and policy change.